The next talk will be by David Zarav, and the topic will be on-fast OCT, Patho anatomical insights into the macula and its related disorders.
Thank you very much, Jemmy, and to the organizers for allowing me to talk on on-fast OCT. In this talk, we'll cover the principles and advantages of on-fast OCT, insights into macular anatomy that it has allowed, and also discuss insights into various disorders, including intraretinal dimples, PAM, MUDES, placoid diseases, and finish off with type 1 macular NV, all of which have been elucidated with on-fast OCT in our clinic. On-fast OCT provides dense volume reconstructs a dense volume of cross-sectional B-scan data sets into a coronal or en-face plane at a given segmentation plane. As you can see here, this dense volume set can then be reconstructed into a coronal plane at a given segmentation level. What this will allow us to do will be to assess and evaluate hyper and hyporeflective lesions and the pattern of those lesions on a fundus image at a given depth resolve segmentation. On-fast OCT has allowed us to identify these remarkable hyperreflective dots that we see in normal patients in the central fovea. In this particular study, we threshold the size and reflectivity of those dots and quantitated them according to the age of decade and found they significantly increase over the lifetime of patients, especially over the age of 50. As you can see here, the top left panel is our youngest age group example, the bottom right, the oldest, and these hyperreflective dots progressively increase in number. We believe these may relate to the central cluster of Mueller cells that insert under the ILM. In this three-dimensional image of a scanning electron microscopic image of the fovea in a human patient, you can see those central cluster of central cluster of Mueller cells as they insert under the ILM. On-fast OCT has also helped us understand various macular disorders like intraretinal dimples. We were actually able to use this instrument to quantitate the size and area of dimples, and you can see that they actually are first identified at 1 month and progressively increase at 6 months and then stabilize thereafter. It's interesting that you do not see the dimples in the first month postoperatively. And this may be attributed to retinal edema, which masks the dimples, which we believe are the result of Mueller cell footplate avulsion. As the edema resolves postoperatively, the footplates are then uncovered in the 1 to 6 month period. On-fast OCT has also helped us better understand paracentral acute middle maculopathy, which is a hyperreflective band at the level of the internuclear layer. If you plot these lesions on an en-face plane, you will actually see that PAM can have either a globular or this very remarkable perivenular pattern, fern-like pattern. When we overlay the vasculature on the en-face OCT, you can see that these perivenular PAM lesions are exclusively in a perivenular pattern with periarterial sparing and actually have a spectrum of severity which may indicate an ischemic cascade. In fact, in this patient, we can see the perivenular PAM pattern progress to a globular pattern. Other cases can even progress to intraretinal infarct, indicating that ischemia may develop at the perivenular pole first, which may be at perivenular pole of the deep plexus, which may be at greatest risk of oxygen desaturation. It is important to differentiate PAM from AMN. These both cause perifoveal, grayish, hyporeflective lesions, but PAM develops at the level of the middle retina. AMN is an outer retinal problem. If you actually use on-fast OCT to co-localize these AMN lesions, you will actually see that it co-localizes very precisely at the level of the ellipsoid zone, as you can see in these examples. We also have used on-fast OCT to better understand the spots and dots of MUDES. The larger spots are co-localized at the level of the ellipsoid and are the result of ellipsoid zone disruption. These also co-localize beautifully with the characteristic fundus autofluorescent, hyperautofluorescent spots you see with autofluorescent imaging. The dots are hyperreflective and overlie the spots. And in fact, both resolve after a period of 3 weeks. But if you use on-fast OCT, you can see that the spots which co-localize with ellipsoid loss resolve first, leaving the dots which resolve later. You can also appreciate that on fundus autofluorescent imaging. These larger confluent spots are readily visible, but as time goes by, the spots resolve and leaves just the dots behind. OCTA and on-fast OCT has also helped us understand placoid diseases. The areas of choroidal ischemia are readily visible on OCT angiography. as well as ICG angiography. You can actually co-localize the areas of ischemia with the placoid outer retinal lesions using on-FOS OCT and see that the choroidal areas of ischemia are driving those placoid areas. We showed this in this particular study. The areas of choroidal ischemia map beautifully with the on-FOS placoid lesions at the level of the outer retina and seem to be driving these outer retinal placoid lesions. Finally, I'll talk about type 1 neovascularization and atrophy. On-FOS OCT is a very valuable instrument in identifying and quantitating atrophy. In this particular study, we were able to map the areas of atrophy with on-FOS OCT and overlay the areas of neovascularization and see that the area of atrophy develops and progresses away from the neovascular focus. You can again appreciate that here, the on-FOS area of atrophy identified by the choroidal hypertransmission, the area of neovascularization by OCT angiography, the area of atrophy progresses away from the neovascular lesion. This is a concept that was initially posited by Grosvenor, Klaus, and Green, in this paper in which they indicated that the choriocapillaris may be the neovascular lesion may be recapitulating the choriocapillaris and protecting the overlying RPE and photoreceptors. On-FOS OCT can also be used to quantitate areas of atrophy in AMD and other disorders and can be a very useful, practical, quantitative tool, as you can see in this particular patient over time. So in summary, I've illustrated the principles and advantages of on-FOS OCT, the insights into macular anatomy that it has shown, especially in identifying these hyperreflective dots, which may represent Mueller cell end feet, and also the insights that on-FOS OCT can give us into various macular disorders, such as intraretinal dimples, PAM, AMN, MUDES, placoid diseases, and in the evaluation of neovascular and atrophic AMD. Thank you very much for your attention.